Today topic of discussion tumors of lungs. Lung cancer is the most common cause of cancer related death. It occurs most often between ages 40 and 70 years. Coming to classification, lung cancer are classified into histological type and clinical type. Histological type can divided into 5 types. Histologically, we divided lung cancer into 2 types. Clinically, we divided into 2 types. What are the 5 types of cancer? Squamous cell. Okay, first one is squamous cell carcinoma. Second one is small cell carcinoma. Third one is adenocarcinoma. Fourth one is large cell carcinoma. Fifth one is combined. So these are the 5 types of cancers under histological types. Squamous cell. Second one is small cell carcinoma, adenocarcinoma, large cell carcinoma. Next one is adenocarcinoma combination combined squamous cell carcinoma. From these 5 types, clinically small cell carcinoma and non-small cell carcinoma. Small cell carcinoma first category, non-small cell. Except this small cell carcinoma, remaining 4 squamous cell, adenocarcinoma, large cell carcinoma, combined squamous cell carcinoma. 4 things comes under the category of non-small cell carcinoma. So totally 5 types. Small cell carcinoma comes under first one. Remaining 4 things. This squamous cell carcinoma, adenocarcinoma, large cell carcinoma and combined squamous cell carcinoma comes under non-small cell carcinoma types. Why the small cell carcinoma only different? Clinically, we are divided only 2 types, small cell and non-small cell carcinoma. Why this one only different means because of the treatment of small cell carcinoma and prognosis of small cell carcinoma is different from rest of them. That's why it is necessary to separate and identify the small cell carcinoma separately. Treatment and prognosis is different. That's why it is separate. Then small cell carcinoma treatment is very easy. Prognosis is very poor. Okay, treatment very easy. Prognosis worst prognosis from all 5. They are most radio sensitive and hemosensitive, so they respond to radiotherapy and chemotherapy. Next, mutation which takes place in lungs, which leads to this lung cancer. So there are 2 mutation, EGFR mutation, VEGF over mutation expression. These 2 mutation leads to lung cancer because of ECFR and VEGF. Both causes mutation leads to lung cancer. Next, cross. In cross, there are 2 type of presentation. You can see the lungs. This one is the hilum part, hilum center, hilum. Tumors are known as central or hilar tumor. Here only tumor will occur, means this one is the hilum part. So hilar tumor or central tumor. This one started in early stage only, so occlusion takes place. Next one is that tumor present anywhere. Okay, anywhere, very anywhere presentation. These are the two type of presentation. This hilar presentation, here tumor are presented in this branchus more often on right side. It is mainly presented in early, okay, early. Here occlusion of lumen takes place. But periphery, here no occlusion of tumor takes place. So branchus takes place in late. So it takes place in late. Consolidation of a large part of that lungs. Now coming to microscopy. Microscopically important features of each of them. Let me discuss one by one. First one is squamous cell. It having other name epitermoid carcinoma, which is most common type in the world. Adenocarcinoma most common type in the world overall. Which is most common type in India? Squamous cell carcinoma. Which is most common type in male? Squamous cell carcinoma. Which is most common type in the female? Adenocarcinoma. Which is the most common type in smoker? Squamous cell carcinoma. Which is most common type in non-smoker? Adenocarcinoma. So most common type in world, male smoker, squamous cell carcinoma. Most common type in India, female and non-smoker, adenocarcinoma. This is the major difference. That squamous cell carcinoma occur in centrally. So it occur in centrally. So it have that name hilar type. Histologically, if we cut, okay, this one we will cut and make a slide. See the picture. Tumor cells are arranged. These are the things, tumor cells, in the form of sheet. Here pink color one, in the form of sheet. In the sheet, see individual tumor cell. It is the individual tumor cell. Some pink color material outside. Okay, this one is the pink color outside of the cells. Also inside these cells also, inside these cells also pink color material is presented. That name is called as keratin. So important features of this squamous cell carcinoma is keratinization, pink color one. It is the important feature of squamous cell carcinoma. This one not only in lungs, anywhere in the body. This keratinization is presented. Keratinization intracellular as well as extracellular. When it is present extracellular, it is presented in that form of, okay, it is presented in this form of pearl, or in the form of pearl or whirl. So intracellular and extracellular keratinization is the feature of squamous cell carcinoma. Now, what is the marker for this tumor? It is brown color liquid presented in the bottle. Spread the liquid over the slide, over it. If it is squamous cell carcinoma. It is pick that marker, that name of that marker, cytokeratin. So this one is the liquid form. We spread the liquid over the slide. It will pick that marker, means that patient affected from squamous cell carcinoma. Marker name is called as cytokeratin. Here mutation happen in P53. These are the important point. Keratinization, mutation, P53. If I spread this cytokeratin over it, squamous cell carcinoma pick it, other carcinoma not pick it. Second one is adenocarcinoma. Overall, this one most common type, worldwide affected, non-smoker and female. Adenocarcinoma, worldwide affected, commonly women and a non-smoker. It causing cancer in periphery region. Then it having 4 types, acinar types. That means it having glandular. Second one is papillary. Papillary means finger like projection. Third one is branchioalveolar. Fourth one is solid. Now we want to discuss that 4 different type of diagrams. So fourth one is solid with mucin production. First one is acinar diagram. See here that gland. It is a glandular. Second one is that lebetic. Lebetic or branchoalveolar. Here what is happening? This one is alveoli. This one is the alveoli. Lungs is made up of alveoli. These are the tumor. Okay, in this alveoli here tumor. Tumor cells in alveoli. Such pattern is known as lebetic. So lebetic tumor is spreading over the alveoli. Is known as lebetic pattern. Third one is papillary. There are multiple pink color projection, papillary finger like projection. Fourth one is compact. It is solid, entirely solid, full solid. These are the 4 pattern. Branchoalveoli are important. Here special type of cell is presented, Clara cell. Marker for adenocarcinoma, specific marker TTF and CK7. Cytokeratin is common for adeno and squamous cell carcinoma. TTF only separate for adenocarcinoma. This one TTF marker, that liquid spread over the slide, over it. If it is this lebetic cell, means it can absorb, it will pick up that marker. So TTF pick up only by this adenocell carcinoma. This lebetic cell absorbed. Inside alveoli present a tumor cell, it will pick up this marker. So third type of cell, small cell carcinoma, it is also known as oat cell carcinoma. What is the diagram? Here this one is the tumor cell. Tumor cells are small like lymphocytes, very small like a lymphocytes. Small cell is presented ill-defined cell border. Small round blue color nucleus is presented. Here necrosis also presented, predominant. Cells are small in ill-defined border. Suppose if zoom it, the tumor cell, zoom it, we can see that nucleus. We can see that nucleus of the tumor cells. Small, okay. Salt plus pepper, how it look? White, black. Okay, so this one, inside that nucleus, salt and pepper, white black look. So salt pepper arrangement. What is the marker? Marker is chromogranin and synaptophysin. Chromogranin and synaptophysin is the marker. This squamous cell carcinoma, worst prognosis, small cell. Metastasis is very quick in brain. Very quick in brain, followed by adrenal. Second most common. Metastasis quick in brain, followed by adrenal. Then here paraneoplastic syndrome is presented. What is paraneoplastic syndrome? What is paraneoplastic syndrome? Suppose this one is the lungs, here tumor, this one is the blood vessels. This tumor which secretes some hormones or protein. Okay, so tumor cell secreted some protein or hormone in the blood. And those protein will cause a sudden syndrome is known as paraneoplastic syndrome. This is common in lungs. Here mutation PCL2. This one is response to chemotherapy and radiotherapy. Fourth one is large cell carcinoma. Tumor cells are large, that's why it is large cell. Final one is adenocarcinoma carcinoma. Here both adeno and squamous cell carcinoma, both in same slide. See here glandular pattern, here keratinization, both together is presented. So this one is the adenosquamous carcinoma. So these are the 5 type of lung carcinoma. Then next one is 5-year survival of each cancer. 50% people survive. After 5 years, 50% survive. 50% died without treatment. Bad one, only 0.5% people survive. 95% people died without treatment, without therapy. This one is the bad prognosis. Small cell carcinoma, squamous cell carcinoma. Best prognosis, this one is the bad prognosis. We already discussed what is the meaning of paraneoplastic syndrome. The lungs having tumor, it will secreted some hormones or protein, it causes some disorder. Okay, some sudden symptoms, it is known as paraneoplastic syndrome. This is common in lungs. The hormones are hormone-like factors. ADH secreted, SIADH, ACDH secreted, which is produced Cushing syndrome. PDH secreted, which is produced hypercalcemia. Calcitonin causing hypocalcemia. So PDH hypercalcemia, calcitonin hypocalcemia. Gonadotropin secreted, Kynemacomastia. Kynemacomastia. So now question is, which one secrete which hormone? Tumor that produced ACTH and ADH produced by small cell carcinoma. Then tumor that produced hypercalcemia. It causes squamous cell carcinoma. Gynecomastia, large cell carcinoma. In this video discussed about lung cancer classification, histological 5 types, clinical 2 types, small cell carcinoma, non-small cell carcinoma under 4, squamous cell adenocarcinoma, large and combined form. Thanks for watching.